Good afternoon. I'm Dr. Bonnie Henry, the Provincial Health Officer for British Columbia, and today is our COVID-19 update for May 2nd. I want to start by acknowledging with gratitude that we are on the traditional and unceded territories of the Lekwungen-speaking peoples, the Esquimalt and the Songhees First Nations, and we are very grateful to be able to talk to you today from these lands. We have 26 new cases who have tested positive for COVID-19 in BC today, bringing our total to 2,171 people. This includes 832 people in the Vancouver Coastal Health Region, 992 in the Fraser Health Region, 123 in the Vancouver Island Health Authority, 175 in the Interior Health Region, and 49 people in the Northern Health Region. We continue to have 24 active outbreaks in long-term care and assisted living, including 21 long-term care assisted living facilities and 3 outbreaks that are ongoing in acute care units. That includes 416 cases now associated with long-term care, assisted living, and acute care facilities, 261 residents, and 155 staff who have been affected. 12 of the outbreaks in long-term care have been declared over. We do have one new community outbreak, one that we have been talking about for the last few days, with the Fraser Valley Specialty Poultry. The investigation that Fraser Health has been ongoing in that business has identified 3 cases, and there's an ongoing investigation at this time. We continue to have 50 people associated with the Superior Poultry outbreak and 42 associated with the United Poultry outbreak. In addition, we have 120 people now associated with the Federal Correctional Facility in Mission. One of the more challenging issues that we've had recently is an increase in numbers of cases here associated with the Kerr Lake plant in Alberta, and it's a very challenging outbreak. We know there's a large number of people who work in that project in Alberta, and we know there are continuing to be cases identified in Alberta and here in British Columbia, and I have spoken before about it here in BC. We are requiring people who have come back from working in that facility to self-isolate whilst they're in BC. And we know this is essential work, and people are going back and forth for work. But as cases continue to be found both in Alberta and here in BC, this is very important for us, vitally important for us in British Columbia, that anybody who has been at the site since March 24th needs to follow our requirements in British Columbia when they are home. And this includes your entire family being very diligent about physical distancing, self-isolating on your return. We have and part of our response here in British Columbia to outbreaks in our communities is treating that entire area as an outbreak site, even though people may not recognize that they have contact. We know that sometimes it's very challenging in these types of settings to know who has been a contact with whom. And we have now seen transmission in families when people have come back from working and not realizing they're ill or having quite mild symptoms. And then this can cause an ongoing effect in our communities here, including people who are healthcare workers who have then become ill with COVID-19. So monitoring yourself and your family closely for symptoms here in BC is very important. And if anybody becomes ill, they need to contact your healthcare provider, 811, and make sure that we can assess you for symptoms and whether you need to be tested. The risks in BC are very high. This is part of our response to our pandemic here, making sure that we have a very low threshold for keeping people apart who are sick, any sort of symptoms at all, and we know we have to be extremely cautious when we're connected to any outbreak. And this is the same that we are doing with every other outbreak in our community here. This is the only way we can protect our loved ones. And as we have said many times, this disease is spread within families and within communities. And so this is what we are requiring you to do, recognizing that you have no control over whether you have been exposed or not. But we need you to take these measures to protect your families and your communities here in British Columbia. It is far too easy to tip the scales against us and undo the hard work and sacrifice that everybody here in BC has made. We cannot afford to have any missteps as we look to ease our restrictions in the coming days and weeks. Going back to our cases, we do have 72 people who are hospitalized right now, and at the moment I don't have the number of people who are in ICU, but that will be in our statement later today. Unfortunately, we have an additional 2 deaths to report today, bringing the total number of people in British Columbia who have died to 114. And that includes 1 person in Fraser Health and 1 in Vancouver Coastal over the last 24 hours. And, you know, our thoughts and prayers, of course, go to the families and the loved ones and the care providers for these people. We recognize how difficult a time it is, particularly when we can't have the ceremonies that are so important to us in the same way right now. 1,376 people have recovered fully from COVID-19 here in BC now. So I'd like to take a bit of time today to speak to our youth here in British Columbia. I know many of us are feeling the fatigue and the frustration of maintaining safe physical distance, of not seeing our friends, of having to connect with people in a virtual way. And it's especially challenging for young people where their main connections are often related to friends in school. And we know that the in-classroom schooling has been suspended, and that can make people feel really overwhelmed and anxious. And we know families are doing their best, and it can be very challenging to have your family around you all the time. But we know, I want you to know that you're not alone. We understand that this can be very anxiety-provoking. We understand that there's a lot of things we don't know, and we're working through it together. If you need help, there is people who are here to help. And you can contact the Kids Helpline. That's a really important service that's available for kids, but also for parents who are struggling or have challenges or just need somebody to talk to help them through this. And that's 1-800-680-4264. Don't be afraid to use that. It's an important place where you can get some support. We also encourage you, and I encourage you all, to stay healthy, getting outside. Find some time in your day to get outside and to let off a little bit of that steam by staying active, washing your hands regularly, making sure that we are doing the things that we know can help, and asking your parents and teachers for help if you need it. We want children here across the province to continue learning, but there's many different ways of learning, and your teachers are here to help you with that. But you can also use those online platforms to stay connected with your schoolmates and your friends, and your schools, our superintendents, our school districts, our teachers, our education assistants are all doing an amazing job to keep you connected. I do want to say a special note to the graduation class of 2020. It can be so challenging, and I know for the young people in my life, I hear this as well. The traditional ceremonies and celebrations that we would expect to have when we make this major transition from high school into the rest of our lives are on hold right now, and we won't be doing them in the same way this summer. But take heart, we are thinking about that, and teachers, administrators, and parents are still working to make this an incredibly memorable experience for all of you. And I think, you need to think about this in that you are and will always be unique in the graduating class. It's been over 100 years since we've had an event like this pandemic. Few of us have ever known or will ever experience graduating during the circumstances of a global pandemic, and looking at how we can make that a special and memorable and positive experience in your life. We congratulate all of you on your efforts so far. This has been a long road, and we're not out of it yet. I know that all the parents out there are doing their best to support your kids and provide those ongoing learning activities, whether they're the formal activities you get from school or those experiential learning activities that we get to have every day, from things like cooking or planting a garden or reading a book. When you are working from home and not used to homeschooling, I can understand that this is tough and exhausting. And, do what you can. I understand this isn't easy, and our school system understands this isn't easy, and there is no such thing as perfect. It is an unattainable concept, and none of us should be striving for it. We are all in this together, and we know that there's over 1 billion children around the world that are not in school right now, but that doesn't mean we don't have opportunities to learn. We will make sure your children, who are our future, are given the necessary tools and support to catch up from this. And we will get through this, and we will catch up. And we will give the support to those who need it most as well. School is different right now, but learning, whether it's in the classroom, at home, or outside, doesn't stop. Everybody's circumstances and experience of this pandemic are different and unique, and you need to do what works for you. And that's okay. We'll get through this. Education is a team effort, and we are all committed to making sure we can support our children in the best way possible in the coming weeks and months. I want to recognize as well that this is Childcare Month, and this is important to recognize our early childhood care educators, the childcare professions, our teachers, our teaching assistants, and everybody who is supporting children in the many different ways that we can during this pandemic. This is not forever, and I've said that many times. It is for now, and it's going to be for the coming weeks and months. And we need to continue to do our best to get ourselves through this together. But we have to do that with recognizing that we have more in common than we do have differences in this country and in this province. And we need to continue to take care of each other and support each other through this very challenging time. And I call on all of us to continue to be kind to each other, to be calm as we make our way through this, and to stay safe. Thank you. I'm happy to take questions.
Thank you. A gentle reminder to everybody on the phone, please press *1 to enter the queue. You are limited to one question. I would also ask that you please unmute your phones. You will not be audible until I call your name. First question today is from Tiffany Crawford, Vancouver Sun. Go ahead.
Oh, hi, Dr. Henry. I was just wondering, there's a petition from barbers and stylists calling on the government not to be singled out to be among the first to reopen mid-May. I just wondered what your response to that is.
I'm sorry, the petition from whom?
It's from barbers and hairstylists.
Barbers and stylists. Yeah. Oh, darn. I was kind of looking forward to that myself. But no, I think in all seriousness, we are looking, and we've talked about, our role, my role in making sure that we have those important measures that we need to continue to do in the coming weeks and months to make sure that we can get through this without having a major resurgence of this illness. So that includes washing our hands regularly, not touching our face, staying away when we're ill, and the importance of maintaining safe distances. So with those parameters in place, there are many things that many different sectors can do. So what we will be doing, and the Premier will be announcing later this week, how we're going to move forward using this, but we will not move forward with opening up different sectors until we're ready, until we are sure that they have a plan that is workable, that make sure that we have these precautions and protections in place. It is a bit of a cautionary tale for us that we've seen these outbreaks in these poultry industry, for example. And that tells us that we need to make sure that we have the right safety measures in place in each different area of our economy to make sure that we can all be comforted and understand that we are opening up safely and slowly and methodically. So we won't be opening up barbers and stylists and some of the other industries where we know that that you have to have some close contact until we're all comfortable that we have an appropriate plan to be able to do that safely for everybody involved.
Next question is from Chad Poston, CBC.
Thanks for taking the questions, Dr. Henry. How are you dealing with the pressure to go faster on lifting restrictions as other provinces with more cases have already announced their plans, and some people, as we've seen here in Vancouver, continue to gather to flout physical distancing advice?
I think there's pressure on both sides, and I certainly get it on both sides. If we look at what we have put in place and the orders and restrictions we've put on place here in BC, they have not been as draconian, if you might say, than some of the other places. So we also need to look at timing. So what we've seen from places like Ontario, from Alberta, from Quebec, the timing is along the same lines as what we're doing. All I can say is that we are being very cautious. We want to make sure that we have appropriate plans for each different sector so that people who are working in those areas, as well as people who will be going and using those services, can all be reassured that we have the best things in place possible to protect everybody. So to protect employees, as well as to protect people who are using those services. And that's how we're going to move forward in the coming weeks.
Next, we have a question from Lisa Cordasco, CHLY.
Good afternoon, Dr. Henry. Thank you very much for taking my question. As you evaluate whether to relax some restrictions or reopen some types of businesses, what role does the availability of PPE play for those workers, the availability of PPE for those workers play in your decision-making?
Yeah, so we'll be talking a little bit more about details, but we've seen a number of things in the sectors that have remained open that are really important. So it's things like engineering controls, we call them, physical barriers. There's a lot of protection that you get from a plexiglass barrier between you and somebody who in the grocery store, for example. So those are important things that we need to look at. How can we make sure that those sorts of things are in place, that we have what we call administrative controls, so it's reducing the numbers of people who are together in an enclosed space during a period of time, and personal protective equipment is part of that. So we have been talking about things like non-medical masks, and when you can't, for example, consistently maintain the distance for short periods of time, it might be appropriate to wear a non-medical mask. More details of this will be coming on a sector-by-sector basis, and we've committed to working together with the different industries because we know that they have ideas about how this can work. The basics that we've talked about again and again need to continue to be in place for the coming months. And then we need to have the innovative ideas from the different areas about how we can work within that and increase our safe connections with each other over time.
Next is Amy Smart, Canadian Press.
Hi, Dr. Henry. I know on Monday you said you're going to announce further details about the modeling. I'm wondering if you can just give us a little bit of a general idea of what we can expect that day. I know that the technical briefings are often chock full of information, and are we entering a new phase, or what are we going to hear on Monday?
Yeah, no, it's not anything new or different. It's just more details of some of the things that we've been talking about so far. So I'm going to talk a little bit about the epidemiology, so who has been affected here in BC, who's been seriously ill, just so we all have a good understanding of the impact that we've seen so far in our communities, our families, and on who has been impacted the most. We'll talk a little bit about some of the more detailed pieces basis of the modeling that allows us to believe that if we keep doing what we're doing, we can increase the amount of contact, safe contact that we have without causing a rapid increase in cases. And I want everybody to see the work that we've been using to drive those decisions and to understand where we are in that. So that's what we'll be talking about on Monday, and we'll be talking a little bit more about what I've just been talking about, how we're going to have a process together to make sure that we have the standards that will work for each different sector, so we can all be reassured and know exactly what we need to do to try and to keep things safe in the coming months.
Bethlehem Miriam, News 1130.
Hi, Dr. Henry. Thanks so much for taking my question. I'm curious if you could talk about the possibility of contracting the virus more than once. How often does that happen? Some people feel if they've had the virus, they are immune. Just curious if you can shed light on that.
Yeah, that is a very important question, and I don't know that we have answers. We are looking at that nationally and internationally. There is, you may be aware, there's a new group that has been formed in Canada to look at the question of immunity, and Dr. Mel Krajden, who's one of our scientists and medical microbiologists from the BC Centre for Disease Control, is one of our members on that very august group. It's being headed by Dr. David Naylor. So these are the questions that we're asking. What I can tell you is from the data that I've seen around the world, particularly from China, but more recently a number of case reports and studies from South Korea, from Europe, it's very likely that we do have some immunity when you have been infected with COVID-19. So that means your body develops antibodies that protect you from getting reinfected. We have had a few case reports where people have tested positive and may have had some milder symptoms after they initially recovered. And there was a cluster of case reports out of South Korea, for example, that looked at that. And I think I mentioned at the time that we didn't know whether it was just that they were shedding virus that was not live virus, because the tests that we have are still challenging. And more recently, that seems to be the case. If we look at other viruses, particularly other coronaviruses, once you've been infected with one, you do tend to have immunity, at least for a period of time of weeks or months. It may not be long-lasting immunity, and that's one of the challenges we have with other viruses like influenza, where the virus itself can change quite a bit, and therefore your immunity isn't specific enough the next season, and that's why we need to have an influenza vaccine every year. So we don't know the answers to all of these yet. Part of knowing the answers will be having a very valid test. And as I've mentioned, we're doing a lot of validation of different serology tests that measure people's level of antibodies. The other thing we don't know yet is if you have to have a specific level of antibodies in your blood to have full protection. And some people who maybe had a mild illness, they don't develop enough antibody to have full protection. So these are all the challenging questions that we don't yet have all of the answers to. I believe most of us, looking at what we've seen so far, believe that people who have been infected have immunity for at least a period of time. Whether that's weeks or months or years is yet to be determined.
Next question is from Moira Witten from the Tyee.
Hi, good afternoon, Dr. Henry. I want to ask you a little bit more about a trend. We're seeing Fraser Health surpass Vancouver Coastal Health Region and the number of cases, and that wasn't the case earlier on. What are some of the factors that might be contributing to that change or that faster growth in Fraser Health?
Yeah, this is, we know that the outbreaks, particularly the long-term care facility outbreaks that happened in Vancouver Coastal early on, drove a lot of the transmission in that community. Now, of course, it's some of the community outbreaks that are making up a large proportion of the cases that are reported from Fraser Health, including the Federal Correctional Facility at Mission. So all of those cases are in the Fraser Health region, as well as the two now poultry outbreaks are in the Fraser Health region, and there have been a number of long-term care facility outbreaks. We continue to see small numbers of people who have traveled who continue to pop up as cases as well in different parts of the province, and we know we've had some temporary foreign workers who've developed some illness, thankfully, while they were in quarantine, so that hasn't been transmitted. So these are the things that we're watching. Most important as we're moving into this next phase of our pandemic is finding those people in our community that are not linked to a specific outbreak or a cluster, and that's what we're putting our attention to in public health, making sure we have the testing that's available for people, anybody with symptoms in the community, and making sure public health has the resources to do that essential contact tracing very quickly. So that's how we'll be monitoring things over the coming weeks and months.
Shirsti Gangda of CKNW.
Hi, Dr. Henry. Thanks so much for taking my question. I'm just wondering, we're a couple of weeks out from the Easter long weekend now, and you'd mentioned that earlier we didn't have information about whether travel or anything over the long weekend actually did lead to a spike in cases. I'm wondering if you have more insight on that now and if you're concerned with the May long weekend coming up.
Yeah, so we have not seen a spike related to travel. The relatively low level of travel that happened over the Easter weekend, and we certainly have not seen introduction into some of the communities that were very concerned. So that's good. It means that people were paying attention and taking the advice that we gave them about non-essential travel. And I said it at the time, and I continue to say, we need to realize that we don't always know people's circumstances, and there can be very good reasons why people need to travel, need to move from one place to the other within our province, and we need to be compassionate and understanding of that. I'm hopeful that when we look at the May long weekend, we will again ensure that people are taking the appropriate precautions and not recklessly or without needing to travel, going to places where they may not have the capacity to support you if you become ill, and ensuring that we are all taking the measures across the province that will reduce our risk of transmitting to anybody in our family or our community.
Jen St. Dennis, CTV.
Hi, Dr. Henry. We have a call in from a woman whose husband has pancreatic cancer, and his surgery was delayed because of the COVID-19 restrictions. He finally had his surgery on Wednesday, and the cancer was found to be quite advanced, and he's now in a palliative care situation. And his wife has still not been able to visit him because of COVID restrictions at Royal Columbian Hospital. She's now been given just 1 hour to visit him today. So I'm just curious about that situation. Is that really the way that it's supposed to be working right now?
You know, I cannot comment on individual situations. I know that that cancer surgeries have been happening. There are very many reasons why somebody will or won't have surgery at a specific time. And we know that the visitor policy is in place to protect all of the people in that setting. Absolutely, I know that in every setting, when people are in a situation where, particularly if they're in a situation like you described, that there are allowances to make sure that people can be safely visited without putting people at risk. So I know that it's a very challenging situation for everybody, and that everybody's individual stories, as I've said, you know, people's experiences of this pandemic are unique, and we need to have compassion for that. And it is up to the care teams in each place that make the decisions and support people to be able to have those all-important visits with their family members during these times of crises.
Brishti Basu, Victoria Buzz.
Hi, Dr. Henry. Thank you for taking my question. I was just wondering if you could clarify some of the outbreak case numbers that you mentioned today. In yesterday's statement, it said that there were 133 cases at Mission Institute, but today you said there's 120. And also at Superior Poultry, yesterday's statement said 52 cases, while you said 50 today. And as well, do you have a number for for how many cases are linked to the Kerr Lake project?
Yeah, you know what? I realize that it's a challenge to get the numbers in for some of these early on a Saturday morning. So I gave you the numbers that were on my translated into my sheet from yesterday. So I apologize for that. We'll make sure that the numbers are correct in the statement that comes out later today.
Bob Mackin, Breaker News.
Hi, good afternoon. You're collecting stochastic modeling information, which you use in order to help inform the possibility of hospital stays for the coming week and for long-term modeling. Why aren't you releasing the stochastic modeling and to show us what's going to be happening in the future? And why haven't you shown us the stochastic models from previous weeks? And also wondered about the reason for you not having the statistics today about the numbers in critical care. There don't seem to be many people in critical care to begin with, and there was one health authority, Island Health, yesterday, which had nobody. Are you not showing us the critical care numbers today because you don't want further questions about why people can't get their sick loved ones into hospitals for their surgeries?
No, it's something much more mundane than that. The numbers were the people who pulled together the numbers on a Saturday morning. They usually come in by noon, and so today, because we started at noon, we hadn't got the numbers in yet. So that's all I can say. There's nothing nefarious behind it. It is the fact that we have many hospitals and many health authorities, and it is actually not as simple as you could think to actually understand who is in which ICU, who is in which hospital, who's positive for COVID. So it is one of the challenges that we have with our just pulling the data together, and it takes a lot of work from each of the health authorities, our epidemiologists who have been working every day on this for a long time. So it is only a matter of timing, and because we start earlier on Saturdays, we don't have those numbers, but we'll make sure that they're in the statement later today when they come in.
We have time for one more question today. For any reporters that didn't get to ask a question, there will be a statement released later this afternoon. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the Provincial Health Officer's orders, visit gov.bc.ca/PHO guidance. Last question is from Bon Palmer, Vancouver Sun.
Good afternoon, Dr. Henry. Almost every day I get a note from someone who points to the example of Sweden and the progress they are supposedly making there on what they call herd immunity and what you prefer to call community immunity. Do you think we really have anything to learn from the experience in Sweden, and particularly this quest for community immunity?
Yeah, you know what? I've been watching Sweden and have been looking at the measures that they've taken, many of which are actually very similar to the measures we've taken in terms of, they have limited in-school classroom teaching. They have limited gatherings and groups and things like that. They have taken precautions around restaurants and other settings, though they may not be as extreme or to the extent that we have here. But a lot of what we have done is very similar than Sweden. I will say that the case fatality rates and the population fatality rates in Sweden are very, very high. So I think it's a balancing of how much you value that response. They also have no evidence that we can see yet that they've reached a level of community immunity that would be protective from further outbreaks over the coming weeks and months. So it is a strategy that they've taken. I think the other challenging thing for us that is different from Sweden and from some of the other countries that have done amazing things, like I think of New Zealand and Australia, and is that we are very close to a very large country that's having itself a very large outbreak. And as we know, early on, Washington State had a dramatic increase in cases and community spread that affected us quite dramatically here in BC. So it's a balancing. We all have our own pandemics, and we all have our own approach to making sure we're doing what we need to do, given the situation that we're in. And I think we've done that here in British Columbia. We've made some decisions about how we're going to approach it, and people in BC have been doing their part. And that has protected us. It's protected our healthcare system, and it's protected us in terms of people who are being affected, who are more vulnerable to having severe illness or deaths. And I think we can't go back and change. We need to continue to thoughtfully make our way and make the decisions that are best for us for the situation that we're dealing with here in BC. Numbers for the previous question, that our modeling, our testing, all of that is published every afternoon on the BC CDC website, so people are welcome to look at that. We will present some more of the dynamic modeling that we've been doing on Monday, and we've presented some of that already, but we'll look forward to providing some more information and data for people on Monday. So thank you very much.
Thank you.